Correct.
Thank you, Mr. Chairman. Appreciate it very much. Mr. Roth, recently a major Florida employer announced that they were dropping health care coverage for part-time workers because the health care law effectively outlawed the low-premium, limited coverage plans that were offered to their employees. I'm concerned that this law is making coverage more expensive for Florida and causing premiums to increase an average of 61%, according to actuarial studies. Could you elaborate on the provisions of the ACA that will raise the cost of coverage for small employers and other individuals in my state?
One element that's going to raise the cost of coverage is requiring a very large, generous plan rather than the plans that the employer you mentioned had before. So those are not going to be permitted. So that's one thing that raised the cost of coverage. Another thing that raised the cost of coverage is be able to sign up at, I shouldn't have said any time, at any open enrollment period, because that means you can go without insurance, you can pay the tax legally, and then you can sign up at the next open enrollment period, and in the meantime, go to hospital emergency rooms. A third thing is just the big new administrative costs of providing health insurance with the mandatory electronic records, all the new administrators, all the new IRS officials who are going to have to calculate what kind of penalties people are going to pay. Also the subsidies, which reach up to 400% of the poverty line. When you go to an exchange, the amount you pay is going to depend on how much you earn. Again, this is a very big administrative burden. The tax credits for small business, those phase out. That's not for all small business. It phases out between 10 and 25 workers. So you get the most tax credit if you have 10 workers, declining to 25. You employ 26 workers, you don't get a tax credit. It also declines if your average wage is between $25,000 and $50,000. So it will steadily decline from 25 to 50,000. If you pay an average wage of 50,000, you don't get the tax credit even if you have over 10 workers. So all these different things increase the cost of health care. But I would say the number one is mandating a large, generous plan and completely disallowing the smaller plans where people shop around and so they pay more attention to their health expenditures.
Thank you. Mr. Boucher, do you feel HHS has been forthcoming with the guidance on how to implement the healthcare law, the provisions of the healthcare law? If not, has this made it very difficult, of course, for you and others in the industry to manage?
I think they have in some cases, but there's still a lot of uncertainty with regard to many of the rules. There's a laundry list of items that I'm still not clear on how it's going to affect our business or even our employees. And we're anxious to hear how it's going to be defined so that we can plan and strategize for our future. Because right now we're just waiting and trying to work. The association is trying to work and find solutions that work for both parties. But we need some answers that work.
Thank you. Again, last question for Mr. Boucher. Has navigating the ACA regulations forced you to incur any additional costs?
Well, as I stated earlier, I personally have spent, and my human resource person has spent upwards of 100 hours just filtering through all of this. And I anticipate it to continue, not at that pace because we're up to speed pretty good now, but there's still a fair amount of work to do once these rules continue to come out. And then ongoing, the administrative efforts that we're going to need to track and enroll employees if the auto enrollment stays as it is at 90 days, which we're opposed to, that is going to be an extremely difficult process for us. And even right now, looking back to try and determine the look-back period, we're having to deal with two different sets of data because we switched payroll companies at the end of the year. So we're trying to meld one payroll company's data with this year's payroll company data. They don't really talk to each other that great, and neither one of them has a great system in place right now for helping us to track that looking forward. So I feel like we're behind schedule here, and I personally would appreciate some relief in some fashion so that we're not subject to some kind of penalty because either the payroll companies aren't up to speed or the rules haven't been defined yet. And that's really the crux of the uncertainty that we're facing.
Thank you, Mr. Chairman. I yield back.
Chair.